difference in induction protocol when you are dealing with an IVF? See, a patient of PCOS is coming with an IVF, you are planning IVF. Is there any difference of protocol of ovulation induction, or it's the same?
Yes, and the main purpose is to avoid multiple pregnancy and, of course, ovarian hyperstimulation syndrome. Now, in an IVF cycle, it's a little different. The initial what we discussed was for simple ovulation induction after reducing the weight, etc. But now, supposing she's for a higher stimulation called as controlled ovarian stimulation, it depends on the AMH level. Anti-Mullerian hormone we start doing now. Because somebody has a very high AMH, she's going to hyper respond. So body mass index is very high. She would not respond too much. She may be less sometimes. So depending on the weight and depending on the, of course, the AMH levels and the antral follicular count. I always say the ovaries normally should have only 8 to 10 antral follicles count without PCOS. Somebody has 8 to 10 per ovaries normal. They are not PCOS. Somebody has 15 to 20 per ovaries PCOS. And somebody has 4 to 5 per ovary is a poor responder. That means their AMH has gone down. So very simple to understand. Remember 5, 10 and 15. Exactly it's not 5, 10 and 15, but remember 5 and 15. But 15 is usually PCOS, 10 is normal, 5 is bad. So that means in each ovary. Now, somebody has a PCOS, that's what we are discussing now. The dose is, there are again 3 kinds of dose. We have either normal responders, we give 200 225 up to 300, okay? But the PCOS we use less, 150 to 225. So, but when a PCOS, always we start with a lower dose because we are scared about ovarian hyperstimulation syndrome. But it's a daily injection. But here what happens is, we start from the second day for about 4 days, and you estimate the estrogen and do the ultrasound on the 5th day. So why? Because we should not get ovulation in between. If she ovulates, we lose all the eggs. So what we should do, if the estrogen is going up, we know LH receptors will be stimulated and LH will go up. So the follicle should be around 12 to 14 millimeters after 5 days of injection or 4 days of injection. Then you start antagonist. You antagonize LH. I think they should know the basics. Antagonists are antagonizing LH. And when do we start? We start on the 5th day usually, or the 6th day. But by 4 days of injection, the follicle becomes 12 to 14 millimeters. And if you look at the estrogen, it will not be more than usually 400. 400 picogram is ideal. When somebody has more than 14 millimeter on day 5, say 16, estrogen is already 600, 700, they'll ovulate very fast. So we should aim at giving small dose at the beginning. Then do on the 5th day ultrasound, 12 to 14 millimeters, 300 estrogen, picogram estrogen, you start antagonist. Another 4 days. So total stimulation will come to around 9 to 10 days of stimulation before we remove the eggs. So it will be careful because whatever you do, they will hyper respond.
Sir, do you have a habit of doing LH levels? No need.
Yeah, I do LH levels on the 2nd day to really know how the bad LH is. Otherwise, again, no recommendation by the European International Guideline. But I think Asians have a different PCOS. LH is sometimes high. But we don't bother about it. It just goes on. If it's too high, then I would see what I do is if the LH is very high, we may give OC pills for 1 month and then call her next time.